I think every patient is unique in their own way, so I like to individualize my care for each patient, and I want to figure out their short-term and long-term goals. And through that, I provide options for my patients to choose from. And through shared decision-making, we come up with a final plan for the patient moving forward. Growing up, I was an athlete myself. I competed in basketball all the way through the college level. And throughout that process, I had many injuries myself, and some of them requiring surgery, involving the shoulder, the knee, and my ankles. So I bring a very unique perspective, not just as a medical provider, but also as an athlete and even a patient myself. Another unique background is I'm triple fellowship trained, and that allows me to be highly specialized in different parts of the body, whether it's the knee, shoulder, or elbow. And I think that allows me to provide the best care I can for my patients. Typically, patients present to my clinic with complaints such as pain, limited joint mobility, and just having difficulty performing activities they like to do, whether it's training for a triathlon or returning to work, or even just grandparents trying to take care of their grandkids. They have limitations and have discomfort while they're doing the activities they like to do. So joint preservation is essentially a very comprehensive approach involving both surgical and non-surgical treatment modalities. Essentially what we do is we do everything just short of a joint replacement surgery. I think joint replacement is a great procedure, but it may not be the right procedure for every patient, and that's where I can come in and help. Essentially, we try to preserve as much native anatomy as possible and to repair the tissues that are broken down in hopes of returning the patient to the activities they like to do. A good candidate for joint preservation is anyone who was previously active but currently has a debilitating joint disease and limiting their ability to do those activities. Minimally invasive surgery is when we use small incisions, specialized instruments, and advanced imaging to perform surgeries that were previously done with open procedures. This allows the patient to have less trauma to their tissue, a faster recovery, and hopefully return to activity as soon as possible. So research is a major part of my practice. I continue to be actively involved with 3D printing researchers and patient-specific instrumentation, as well as robotic-assisted surgery. In my practice, I apply these concepts for my patients as well. And with these technologies, it has drastically improved the accuracy of our care, as well as improved patient outcome in many different ways. What I enjoy most about my work is knowing that I can make a positive impact for my patients, getting them better and returning them to the things they like to do, and that really motivates me on a day-to-day basis.